Dr. Baliga here. This podcast is the third and final podcast on malignancies of the head and neck, the summary podcast of the earlier two podcasts, and it's about the must-know facts about malignancies of the head and neck. It is derived from an outstanding chapter on malignancies of the head and neck by Dr. Glen Hanna, MD, and Dr. Jochen H Lorch, MD. Dr. Hanna is Assistant Professor at Harvard Medical School, and Dr. Lorch is Associate Professor at Harvard Medical School and Director of the Thyroid Cancer Center. Both Dr. Hanna and Dr. Lorch are faculty oncologists at the Dana-Farber Research Institute in Boston. The chapter is derived from Baliga's textbook of internal medicine with 1480 multiple choice questions and is available at www.mastermedfacts.com. Head and neck cancers are a diverse group of malignancies that are relatively uncommon but often demonstrate aggressive behavior and are frequently associated with significant morbidity and mortality. The head and neck is a complicated anatomic region and is often divided into the nasal antrum, oral cavity, pharynx, and larynx, given that each anatomic subdivision yields different tumors and often warrants a varied treatment approach. Must-know fact number 1. More than 90% of all head and neck malignancies are squamous cell carcinoma. Must-know fact number 2. A growing body of evidence supports the role of human papillomavirus (HPV) infection in the development of head and neck cancers, especially HPV type 16, and as many as 75% of oropharyngeal squamous cell carcinomas are associated with HPV infection. Must-know fact number 3. There is a strong association between Epstein-Barr virus (EBV) infection and the development of the endemic form of nasopharyngeal carcinoma, which is WHO type 2 and 3. Must-know fact number 4. Major risk factors for head and neck malignancies include tobacco and alcohol use, prior neck irradiation, and certain viral infections such as EBV and human papillomavirus. Must-know fact number 5. CT imaging remains the most informative diagnostic study in the evaluation of a potential head and neck malignancy. Must-know fact number 6. There is no strongly recommended laboratory studies in the evaluation of a patient with a suspected head and neck malignancy, and screening remains a difficult problem, and there are no generally accepted criteria or recommendations. Must-know fact number 7. The natural history of tumors involving the head and neck is unique to the location in which the lesion arises, and much of the morbidity associated relates to therapy. Must-know fact number 8. Early head and neck tumors, that is stages 1 and 2, are generally treated with single modality therapies, that is either surgical resection or radiation. Locally advanced tumors are treated with multimodality therapies such as chemoradiation or surgery followed by radiotherapy or chemoradiotherapy. Must-know fact number 9. The mainstay of therapy of cases with distant metastatic disease or disease recurrence not amenable to potentially curable salvage therapy is palliative chemotherapy with the goal of improving survival and quality of life. Must-know fact number 10. Because of the complexities of multimodality treatment, head and neck cancer should be managed by an experienced multidisciplinary team. This is in a nutshell must-know facts about head and neck malignancies, derived from an outstanding chapter authored by Dr. Glen Hanna, MD, and Dr. Jochen H Lorch, MD, both faculty at Harvard Medical School and oncologists at the Dana-Farber Cancer Institute in Boston, Massachusetts. The chapter is derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com.